We're talking about her down there with the vagina and P. Letrice Mason. We're talking about women's care. Come sit down with me. Holistic health solutions and services to women of all ages.
Hello everyone, welcome back to Her Down There, the show where we talk about the unspoken, the confused, and the things women deal with every day. Hi, I'm Letrice Mason. I'm a women's health nurse practitioner. We'll be talking to you today. Today we are talking about PCOS, which is Polycystic Ovarian Syndrome, a condition that affects millions of women, yet is still misunderstood and often dismissed. And later in the show, we will be joined by a special guest who's also my patient who's living with PCOS and will share her personal story. PCOS isn't just about cysts. This is my little trusty uterus. Most women think that PCOS only has to do with cysts in your ovaries, but a lot of times you don't have cysts at all. It's really a hormonal imbalance that affects how you ovulate on a daily basis or once a month, how your insulin works, and how your hormones affect the rest of your body. So there are 4 different types of PCOS. A lot of women think there's just one, but there really are 4, and it's important to know which one you have for you to determine how to get treatment. The first one is usually the one that most people have heard about, which is insulin resistance. And this goes off of cravings. This is someone who is very fatigued or has weight changes. The second type is inflammatory. This can be things on your skin like acne, bloating, and where you have low energy. Then the third one is adrenal PCOS, where you're like super stressed out and it comes off of the stress that you have in your body and the cortisol shifts that you have in your body. Then lastly would be post-birth control PCOS, meaning you were on birth control and then you stopped taking birth control and then you started to have hormonal symptoms. Ladies, it is time for myth or fact, because PCOS comes with a lot of misinformation. So, number 1 example, PCOS only affects the ovaries. That is a complete myth. It affects your hormones, it affects your metabolism, your energy, your skin, and your mood. Number 2, you can have PCOS with a normal ultrasound. This is a fact. Not everyone is going to have every single symptom that PCOS has, and sometimes when you do an ultrasound, you won't have any cysts at all. Number 3, PCOS always causes weight gain. This is a myth. Everyone will not have weight gain. Some people will have normal weight, some people will have weight gain, and some people will actually lose weight. So it's not the same for everyone. And the last one, number 4, PCOS can affect your confidence. Of course, this is a fact. 1, because it can affect your weight gain. 1, because it can help you with having acne. You can have hair on your skin, so it's definitely going to affect your confidence. Understanding the truth helps women, and we have to be there for each other.
Welcome to Her Down There, where women's health and empowerment comes first. Our practice is designed to make you feel comfortable, respected, and cared for. From preventative care like pap smears, to advanced diagnostic services like ultrasounds and colpos to help ensure your well-being. We offer personalized solutions from hormone therapy to medical weight loss and aesthetic services to help you feel your best. And we are proud to offer gender-affirming care to all patients. Schedule your appointment today with Her Down There, prioritizing your health and well-being.
Before we go further, I want to welcome someone very special. PCOS looks different for every woman, and her story is one so many women can relate to. She spent years dealing with symptoms people brushed off, pushing for answers, and learning how to navigate life with PCOS. Please welcome Miss Alicia. Thank you so much for being here. I'm so excited to have you. And I know I probably forced you into doing it, but you're here, so I'm excited. So tell me about you, or so everyone can hear about you.
Yes, I'm Alicia Williams. I'm a recent grad from Ovarian University, and yeah, I've been dealing with PCOS for a long time. And when I first came to you, you answered so many questions that I was dealing with, and just basically helped me get through it. So.
Well, I appreciate you letting me be my little guinea pig.
Yes.
So let's dive deep into what was going on with you. What were some of the first signs you can say that you felt with your PCOS?
One of the first signs was I was dealing with irregular periods, and then it came on to me having like chin hairs and things like that. So then that's when I kind of knew like something was going on with my body.
Those are like really common symptoms, so I'm really glad that you took a chance to come in and try to figure out what's going on. Did you ever feel like you were unheard, or no one was listening to you, or feeling dismissed?
Yes, so actually I got diagnosed back in 2022 at another doctor back where I'm from, back in like Fort Worth. So this doctor, like I know I mentioned like I didn't want to get on birth control and things like that, because when I was doing research it like max your symptoms. I wanted something that was actually going to help me and basically help me without maxing my symptoms.
Right. That makes sense. What would you say how PCOS has affected like how you feel about yourself?
At first I was like, I don't want to have to deal with this, because like at first I had the misconception that I wouldn't be able to have kids. So I know this is something where I was telling my mom like, I gotta hurry up and have kids and things like that, because I don't know. And one of my family members is actually a doctor. He was like, yeah, you need to go to a doctor, someone that looks like you first and foremost, and somebody that'll be able to help you in the right way, because he was like, it is a misconception that people think they can't have kids. It's just that they're not getting help in the right amount of time.
Absolutely. What would you say on a day-to-day basis, what is the hardest part of living with PCOS?
I would say the hardest part is not many people know, because it's like every doctor is going to have a different opinion, or anybody you go to a lot of times is maybe like you're not getting the right help for it, the right testing for it, and a lot of things is getting unignored.
So one of my last questions I would want to ask you is, what would you tell women, other women who are going through it right now and feel alone or on their PCOS journey?
What I would say is definitely go to someone that actually know what they're talking about, and someone that actually listens to your goals, and somebody that's able to help you find it in ways that it's just not maxing, it's actually helping you. Because a lot of times people will put you on birth control, and that's just maxing the symptoms. So it's, of course, it's causing more women to gain weight. It's causing women to still have all these other problems. And that's one of the concerns I brought to Miss Mason. I was like, I do not want to take birth control. I want to make sure that I'm not insulin resistant. I want to make sure I'm not on the verge of diabetes and things like that, because when you have PCOS, most women do have type 2 diabetes. So I was like, I do not want to have this. So once I did all my testing and things like that, she was like, no, you're not, and things like that. She gave me the medication, and actually I've been doing way better.
Good. That's the point.
That was,
Well, thank you so much for coming. I'm so happy to have you. And I just want everyone to know PCOS is more than a diagnosis. It's an emotional and physical experience that women struggle with far too long before finding answers. Thank you to our guest for sharing her truth. And thank you to all of you for joining. Come back next week on Her Down There as we talk about chronic pelvic pain, and we talk about all different issues that have to do with all different types of women. Have a great one.